As health workers at the National Institutes of Health in Bethesda treat a patient there with a rare form of tuberculosis, the cross-country search for people who may have been in contact with her is now underway.
Kelly Lynn is in our newsroom with an update on the illness and the action plan here. Kelly?
Allison and Leon, this case is attracting so much attention because this form of TB isn't only hard to treat, it can be deadly. TB is an infectious disease that's caused by bacteria that usually show up in the lungs, where they can lead to symptoms like chest pain and coughing up blood.
At NIH in Bethesda, a challenging case.
This is a big deal.
A dangerous form of tuberculosis that's resistant to treatment. According to the Centers for Disease Control, the woman came to the U.S. on a flight from India to Chicago 7 weeks ago. She was aware she had TB and came to the U.S. for medical intervention. Although she received multiple treatments in India, she never finished the therapy. Another concern. After arriving in Chicago, the woman visited Missouri and Tennessee. Now authorities in 3 states are scrambling to find and notify the people with whom she came in contact. Tuberculosis can spread through the air when a person sneezes, coughs, or talks.
The good news is TB is not contagious like a cold or the flu.
Every year, about 9 million people around the world become ill with TB, and there are 1.5 million TB-related deaths. Although health officials don't think anyone on the plane was infected, they don't want to take any chances.
Anyone in her row or 2 rows in front, 2 rows behind, they'll be tested and monitored for 2 months to see if they have the infection.
And doctors use blood and skin tests to confirm TB exposure. As for the patient, she is now in stable condition at the NIH Clinical Center. Her form of TB is known as XDR-TB, which stands for extremely drug resistant. It is so rare, there are only 3 to 4 reported cases every year. Back to you.
All right, thank you, Kelly.